most of you know, I've been seconded in to work on the nutrition and food standards and guidance for different settings, and the first setting we looked at was childcare. So, which one did I press? The right one?
Yeah.
So what I'll run through is an overview, and because obviously there's going to be a lot of detail on different work that's going on within settings, mine is more of a strategic overview of how it fits into the policy framework from Welsh Government and how then that is disseminated across. So I'll be looking at where we came from in relation to the standards and guidance, and then how we developed it and how we can access it. I'll also look at the childcare regulation inspection, because that's where we've done a lot of work, which perhaps we haven't done so much in the past. I mean, I know when I first started in this work many years ago, it was sort of like, we never knew who a childcare inspector was. And through this work, we've had a fantastic positive relationship with Care Inspectorate Wales, and they've been so on board and really part of the work going forward. So we'll look at the aims and we'll touch on implementation and monitoring, because we're not quite there yet with what our plans. So any thoughts on that you have, again, you can get in touch with me. So this started, it was actually it was longer than 2017 actually, but that's when the actual commitment was sort of put in writing, where we had Health Minister commitment to build on the nutrition standards that were already in place for hospitals and schools, and to deliver standards and guidance for childcare settings and older people care home settings. That was able to be done on the back of the Public Health White Paper, which came prior to the Public Health Wales Act, because it didn't require primary legislation. And we could do it on the back of the fact that these settings are already regulated and they've already got legislation. Then the Public Health Wales Act came, and through that we had, as Lisa mentioned, the commitment to develop the Healthy Weight, Healthy Wales strategy. So within that, I mean, I'll go through it very briefly because obviously Lucy's touched on it, but I've highlighted the healthy settings in that within this area we aim to create healthy settings which provide opportunities for people to access healthy meals, snacks and drinks and be physically active, and also work with local authorities, childcare organisations and Care Inspectorate Wales to embed best practice and support the healthy preschool scheme. So as a result of the statutory statutory government drive to develop the strategy, we're able to then add more weight to this guidance in terms of embedding it in those settings. So I hope that makes sense. The legislation is quite complicated. It's taken me quite a number of years to get around it all. So in terms of childcare settings in Wales, I put this up because it's quite interesting to look at, you know, how many children are in childcare settings, and also what type of settings they are. So at the moment we've got around 175,000 children up to the age of 4, and we've got around 80,000 childcare places. So we obviously have only got, you know, just under half childcare places available if everybody wanted to take it up. We have more places available, more settings in terms of childminding, but obviously because they take less children, there'll be perhaps more children in the full daycare settings. So if you look at all those numbers of settings, you know, it's quite a lot to sort of support and help them move forward with ensuring that they provide good food and nutrition. And I think one of the key things that we've wanted to do as well, backed on the good work of the Healthy Snack Award schemes that public health dietitians run locally, and the preschool scheme, is to place as much emphasis on the snack and drink time, as well as those that provide full meals, because as we know, those are the sorts of foods and drinks that can have quite a big impact on children's eating habits and their health going forward. We didn't start from scratch, and I think I must add as well, I mean, I don't know if there's anybody here from a childcare setting that works in a childcare setting? Yeah, good. I must I must stress that we were working from a much more positive sort of baseline than perhaps in a lot of other settings. Childcare settings traditionally have been very positive about ensuring that they provide good food, but it's the sort of perhaps lack of education in terms of the up-to-date nutrition knowledge, the confusing messages, and making sure that every child is catered for in terms of healthy eating. So we also had guidance from 2009, and it was never revised or renewed. So there was a lot of pressure in terms of we need something more because this is out of date. And I think quite a lot of us in the room were around when that guidance came out in 2009. And we had more money then, and we gave every setting in Wales a hard copy, this lovely hardback file. So we've moved on, we're online now. We have still had lots of questions about hard copies, but as you can imagine, looking at the numbers of settings, it's prohibitive to produce hard copies for childcare settings individually. So we've produced, but we are open to feedback on the format of the guidance. So we've produced food and nutrition for childcare settings with a number of sections in it, why healthy eating matters. We are going to add the infant feeding and introduction to solid food. That wasn't part of the initial commitment, and obviously it takes a lot of time to do these things, so that was left out at the initial stage, but they will be going in. Food and nutrition standards, guidelines and menu planning. So that was the main bulk of the work that was going forward in order to provide much more practical information on menu planning, meals and recipes for childcare settings. A section on encouraging children to eat well, food hygiene and safety, and some action plans and guidance on putting it all together. So this is how many of you have seen this? Oh, right, not as many as I thought. Right. So that's the short web link, and my assistant here, my colleague, will click onto it. So this is what it looks like. So what we did was we've provided a user-friendly link to the practical information for settings to use there and then in terms of recipes and menus. So it looks like this. So there's whole sections on breakfast, lunches, tea time, snacks and resources. We did use the meals that had been developed originally by the Children's Food Trust and then taken on by Public Health England and the Department of Education produced guidance for England. But we spoke to them, and obviously there's a good working relationship between the Welsh Government Public Health Division and Public Health England, and we were able to acknowledge their work because the recipes were worked out in relation to nutrient standards, and it was a bit silly to reinvent all that work. So that's where all the practical information is. Do you want to just go on to the snack? Yeah. Oh no, sorry, the tea times. Tea times. So down there you then have all the information around all the different main courses, accompaniments, desserts. So it's all there. Everybody can just access it freely. Go back. Then the guidance is on the Learn More. So that's on the more official Welsh Government website for guidance and information. So the best practice guidance is in the sections that I mentioned, and goes down there, down there. This is great. Scroll down. So section 1 will give you all the data, which Lucy alluded to some of it, but it obviously focused on children, and there's quite a few infographics to be able to ensure that settings are aware of the current situation of children's health in relation to food and diet. So there's the child measurement programme stats, there's the oral health stats, there's the fruit and veg intake stats from the National Diet and Nutrition Survey, so it's all in there in hopefully a user-friendly format. Then if you can skip through to section 4, which is the green, yeah, that's it. If you just slowly go through it while I'm talking, that'd be great. So again, I'm not going to go through it because hopefully you'll have a chance at lunchtime to have a look, and then when you get home. So basically, there's been a huge amount of work put into this to update what we already had and add information on all the changes that had taken place in terms of any guidance. So through the carbohydrate, saccharin, carbohydrate and sugar recommendations, fibre, energy, vitamins, etc. So it's all up to date. And it means we can update it easily because it's on the web rather than sending out paper amendments. But hopefully it's not going to change too much in the next few years. And one of the reasons we didn't do the infant feeding was we were waiting for the SACN report on feeding in the first year of life, and again there's no change in the recommendations, so we can go ahead to do that.
Do you want to go further through?
Yeah, go through to the pictures and things. So each section has got, just keep scrolling right through until you get to pictures. Food standards outlined for all the food groups and for the different meals for the full day care. It's split into two sections. Those that provide snacks and drinks only, so if you're a small setting, you can just go immediately to that section. And if you're a full daycare setting and you provide meals across the day, you can go to the section with all the venues and the meals and etc. And it's got a good section on hydration. One of the not controversial, points of discussion, I would say, was around whether we promoted just milk and water as the main drinks, as the only drinks in childcare settings, and there was universal support for that. That's the advice that they put in the England guidance as well, and settings have been very supportive of that in terms of wanting to do the best in terms of providing the safest and healthiest drinks for the children. So I don't think I'll go into it in too much detail. If you just scroll down to the when you get to see the plates of food. And must acknowledge First Steps Nutrition. Helen Crawley is here and she's speaking after me, I think. So we were able to purchase the photographs from First Steps Nutrition for this because, again, they've been heavily researched and very professionally done. And again, we weren't wanting to replicate that work. So there's a whole range of photographs of the portion sizes in food, of meals, snacks, everything in the guidance. So it's pretty comprehensive. Right, do you want to go back to the presentation? Thank you. I don't know. So I just wanted to give the background on childcare regulations because I know that's something that people may not be so familiar with. All childcare settings obviously have to be regulated and they have to register with Care Inspectorate Wales, and they're under Regulation 21 of the Child Minding and Daycare Wales regulations. And I've picked out the bits of the regulations that are relevant to food, so that registered providers of childcare are currently required to ensure that, as you can read, food is provided is wholesome, nutritious, and so there's quite a lot of detail and quite a lot of information. But the problem is, what we've found is that settings don't really know how to interpret that in a practical way and also demonstrate it, perhaps when they've been inspected. And also what we found from inspection reports is, I mean, I've read through a lot of inspection reports in relation to this work, which has been quite interesting. A lot of it is reported like the wording in the regulation. Yes, this setting provides a healthy, nutritious diet. Yes, this setting provides wholesome food, freshly cooked. But that doesn't really give us much indication of what it is they're providing, if it's in the right proportions and the right balance of nutrients. So this was really part of this work going forward, was to do more in-depth work around that. The other regulation is about drinking water, obviously. So they also must also have regard to the general statement relating to food and drink provision. So childcare settings have minimum standards of care, and one of those standards of care relates to quality of care in relation to food and drink. And the outcome that they're supposed to be able to demonstrate is that their children are provided with regular drinks and food in adequate quantities for their needs. So again, it's how do we assess that and how do settings know really what that means. They are now reviewing the minimum standards of care, and there's a much bigger drive now towards more quality-based outcomes rather than you know, a sort of tick box, yes, they're meeting that, they're meeting that. But they haven't been done yet. So the role of Care Inspectorate Wales, childcare settings undergo an inspection every 2 or 3 years. So, okay, that's not that often to be thinking, well, they're checking on food, because food is obviously a very small part of the whole environment and care that they're checking on. But it's also, you know, they do have it, and if they're not meeting certain things, they will get recommendations, or they will get notice that they're non-compliant, and will have to take action to do that. If they're providing the foundation phase, they'll now have a joint inspection from Care Inspectorate Wales and Estyn, and we have had some meetings with Estyn, and Estyn are now doing a lot more training jointly with Care Inspectorate Wales, and when I do the training later on this year, I will have some Estyn people at that, so that'll be good. So what they're doing now is they've got a new inspection framework, very much based on quality, and they observe, practice and report on the quality of care across 4 themes. So the food will fit easily into the care and development, because they need to demonstrate that they're keeping children healthy and safe. But it also comes into other aspects of care, such as independent learning, play, particularly around meal times, the social interaction. So what we're also going to be doing with the inspectorate is looking at how they can report on food across a whole number of areas of care, not just food provision, so looking at the whole environment. So how am I doing for time? Am I over? No. Okay, so very briefly, obviously for children it will help to establish good eating habits, get the right balance of nutrients, develop and maintain a healthy weight. Obviously the focus here is about maintaining and reaching healthy weights, not about the onus on obesity and weight loss, preventing tooth decay, iron deficiency and constipation, and ensuring they get consistent messages. For settings, it will help them ensure that they're providing the right balance of food and nutritious food in the correct portions. It helps them to encourage children to eat well, and it can help them to promote their setting. So in their marketing information, they can promote it to parents. And for parents and carers, it will help them to make them feel confident that their child is receiving good nutrition and inform them about the settings approach. We have had a few settings feedback during the consultation that one of them was still providing squash because of the pressure from parents. So, you know, one of the big things going forward from this now will be the work that Public Health Wales is doing in relation to 10 steps and the parental information, to actually do that sort of parent-family support to help them support the settings doing the work. So it's that two-way process. But a lot of them have been fantastic in terms of their influence on parents, and saying, no, this is what we give your child. If you're bringing your child to this setting, this is our policy and this is what we're providing. So just to mention Cullen, which is the umbrella organisation representing all the childcare organisations, and they have been a fantastic support in the development of this work. We had a member of each partner organisation from Cullen, which are outlined there, on the operational group. They supported the training, they chaired some of the consultation events, and we launched it in a nursery in Newport, and they hosted the launch there, and we sat there with the kids and met fruit and snacks, and it was all very nice. Apart from the fact, I shouldn't really say it, but the minister didn't come because there was a crash on the M4, so it was all a bit disappointing, but there we go, it went. So we've launched it. The Chief Medical Officer sent a letter to all childcare providers via the Family Information Service. All the partner organisations put it on their web pages. I've written an article for the Early Years Wales newsletter, and obviously public health dietitians and the preschool scheme have been very active in starting to now disseminate that and do updates and include it as part of the training. I'm undertaking some national training for Care Inspectorate Wales with the help of some of the dietitians. We've got 3 regional events which is going to cover the whole of the inspectorate. So we've never done that before. And there'll be obviously local training through smaller updates and Nutrition Skills for Life courses that are run by the dietitians. Monitoring and evaluation. We haven't sort of developed this in detail yet, but we're looking at maybe working with Cwml around having some sort of survey of organisations. I'm going to be meeting up with the Nutrition Skills for Life team when they have their day on evaluation and their courses, to look at what we can perhaps include in that in terms of the data they collect, and obviously the links with the national schemes and the local schemes. So we've got the Healthy Preschool Scheme, we've got Bolio Bach Tiny Tums, which you'll be hearing about today, and the Gold Standard Healthy Snack Award. So all of these now will have consistency across. We've worked together to get that consistency across the criteria around food and nutrition for those awards. So it'll all link up to the standards and guidance that have been produced. We may look at having some focus groups, and I'm also working with Welsh Government and Care Inspectorate to look at perhaps some key indicators that inspectors can look at. So although they'll be observing in terms of quality, they will have to have some indicators to know what quality is. So we may be picking out some key things around amounts of fruit and veg, the water and milk standard, and the portion sizes as part of their general observations, that they can then report on that. And then when they register, they have to do a self-assessment. So we're going to be looking at how perhaps that can be incorporated so that they can talk about it. Oh, look at that summary. So hopefully I will run through very quickly that we've now got further up-to-date evidence-based standards of guidance in a practical and informative way. The aim is to support childcare settings in their role and to encourage children to have a healthy, balanced diet and provide ideas for the whole setting approach. So it's not just about food provision, it's about food in play, using cooking, food safety, and engaging with parents. And that's it. Diolch yn fawr, thank you for listening.